Do we know about COVID-19 and children? Are the vaccines safe to use yet? So parents desperately want to know, when can young children get the COVID-19 vaccine? Professor Haroon Saloojee from the Wits University's Paediatrics and Child Health Department joins me now live. Prof, a very good evening to you. Thanks indeed for joining us this evening. So the data coming from the FDA in the US this week basically approves the safety for the use of Pfizer and Moderna for those aged between 16 and 18. What do we know about the safety and effectiveness of vaccines in children?
So, hi, Griselda. The good news is that the vaccine has been shown to be safe and to be as effective as in adults. So all the benefits that adults receive, children also receive those benefits. And that's obviously good news. So the FDA has approved it from 16 to 18, but in fact, it also allows use, what's called emergency use, from children to 12 and to 18. But the vaccine works in children as well as it does in adults.
Yeah, but is it that studies on this for children under 12 is still being conducted? I know that a bit earlier on when I spoke to you, you indicated that you've requested SAPRA to conduct or to consider those between 12 and 18 who are at high risk. Is this likely to be approved? And talk to us about what we mean by high risk.
Sure. So in some countries like the USA, Israel, China, vaccines are being given routinely to children between 12 and 18. Many other countries like Australia and the UK are still considering it. But those are mostly high-income countries. In less resource countries like South Africa, it certainly is not a priority for children to get it because we need to save lives, giving adults the dosage. Children's turn might come. But there are high-risk children. And what we mean by high-risk children is children with chronic long-term diseases of various systems. So it might be chronic lung diseases, heart diseases, kidney, liver, and neurological problems. So there are a very small group of children who are high risk who should probably be getting the vaccines immediately. And certainly our association, the South African Paediatric Association, has asked SAPRA, the South African Health Products Authority, to permit the use of these vaccines. And the WHO, in fact, says the same thing as well. So there's good reason to believe that these high-risk children between 12 and 18 should be able to get the vaccines fairly soon.
A few adolescents in the United States have developed inflammation, though. Is this a concern for us right now?
Okay, so we know that vaccine have side effects, and the one thing that we've noticed in young adolescents, more boys than girls, is that some of them have developed what's called myocarditis, which is an inflammation of the heart. Now, at the moment, it's not causation. It's not that the vaccine causes this, but there's an association. Means some children who've had the vaccine seem to have a higher incidence of this. But it's a very, very low rate. So in girls, it's something like 9 in a million children. So it's not anything to get too worried about in terms of its frequency. But also, its severity is not too bad. So children who have had it, they've had some treatment that we have for myocarditis arrest, and they've recovered. So it certainly is not anything that should get us too concerned or worried about.
Yeah. I mean, when are we likely to see children vaccinated in South Africa? Clearly, of course, I mean, our priority at the moment being those 18 and above.
Absolutely. So probably not at least till next year. And then the older kids probably first, the 16 to 18-year-olds, because we know the older children are more likely to have somewhat more severe disease than the young ones. But the big question is, should children eventually get it? And in fact, there's arguments. That's why the UK and the Australia haven't, because the reason you're giving it to children is more to protect adults than because the children themselves need it. We know children get mild disease. Very few of them get long COVID, the chronic outcomes of COVID, and very few, in fact, hospitalize and die. So the main reason we want to give children is so that you don't have children who are unimmunized and still carrying the disease. But it's more to benefit adults and the children. The truth is, children probably don't need the vaccine for their own. But with time, we'll probably find this happening. But I think parents who are very worried that the children can't go to school without vaccine in South Africa, I don't think that's a concern. And we certainly won't be offering the vaccine. The government won't be offering the vaccine at least till sometime next year. And I think that's the appropriate decision.
All right, until sometime next year. Prof, thank you very much indeed for joining us on the programme. Prof Haroon Saloojee from Wits University's Paediatrics and Child Health Department. Thanks for joining us on the programme.